My name is Rabbi Melanie Lavav, and I have the honor of serving as the executive director of Shomer Collective, started by a group of friends who had had the experience of someone close to them dying, and they didn't know what to do or where to turn Jewishly. And this fits with what we know about the Jewish population in this country. The majority of American Jews no longer belong to synagogues, and 70% of non-Orthodox Jews marry someone who's not Jewish. And so it's a little harder than it was a few generations ago to access what Jewish wisdom and practice can offer around end of life. And Shomer Collective was created to try to bring that Jewish wisdom back into the Jewish communal conversation. The word Shomer in modern Hebrew means guard. A security guard at the front entrance to your building would be called a Shomer if we were talking about them in Hebrew. And in Jewish tradition, the Shomer is the person or people who take turns sitting with the deceased from the time of death until burial, because we don't leave them alone. And it's understood in Jewish tradition that the shomer is guarding the body, literally in the olden days, from any animals who might catch a scent and seek to disturb the sanctity of the body, but also, as we understand it in a more contemporary way, to provide accompaniment as the soul begins its journey of separation. We understand in Jewish tradition, the soul is contained within our body while we're alive, and the soul begins a journey of separating from the body from the moment of death onward. So the shomer sits with the body, literally accompanying the soul as it begins its journey of separation. It's a sacred occupation, a sacred volunteer role, often done by members of the Chevra Kadisha, the Sacred Burial Society, who take responsibility for the ritual washing and the dressing of the deceased. And Shomer was given to us, the name, by one of our founders to evoke that image of sacred accompaniment. How might Jewish wisdom support us on the journey of living, recognizing that our lives are finite, that tomorrow is never guaranteed? Shomer Collective's work can be seen on three levels. The first, which is why we were founded, is the time before death. Today, how do we live well in the face of mortality, knowing that tomorrow is never guaranteed? And how might Jewish wisdom support us in this idea of living well, preparing for the reality of our mortality? The second is the transition between life and death, that liminal moment. How do we add meaning? How do we benefit from Jewish wisdom and practice in those moments between life and death? And the third piece is after death. What happens Jewishly after we die? How do we mourn for those who have died? And how do we create circles of support? I'll put in a plug for our newest program, shivacircle.org. You can read more about Shomer Collective's work on our website, but a little bit of background. This is data taken from an organization called the Conversation Project. The majority of Americans say it's important to talk about our wishes for end of life care, yet only a minority of us have actually done so. So I encourage you to think about that in your own life, in your work, if you're here as a professional. Does this ring true for you? That most people would agree it's a good idea for us to be having these conversations like we are today, yet only a small number have actually had the conversation in their own lives with the people who are important to them. And as advertised, we're going to talk about these new options for end of life that have been in the news lately as a result largely of changing laws in this country, state by state and elsewhere. I recognize we probably have Canadians here and folks from other countries. So I'm going to touch briefly on the topics of natural organic reduction and green burial and devote the bulk of our time together to medical aid in dying, as this is the third and final program in this series on the topic. Just for some background, in January, the first program in our series, we spoke with former Manhattan Borough President Ruth Messenger about her journey to Switzerland to accompany her husband Andrew during his assisted suicide following his dementia diagnosis. And last month, we spoke with Rabbi Shlomo Brody from our sister organization MAID about traditional Jewish law views on medical aid in dying, halachic views, traditional Jewish law. Today, we're going to focus on the question, now that we heard one family's story and an Orthodox rabbi's views, what are we to do? Who, the rest of us, are we to make these decisions? And I will give us an overview of liberal Jewish law interpretations from each of the major denominations And we'll talk as well about the tension between individual liberties and community responsibility. Who am I with the freedoms I have, my body, my choice? And who am I as a Jew, knowing that it is my obligation to take care of the vulnerable in our community? And how do I think about those two ideas as it relates to medical aid in dying? So, a little bit of background about newer practices: natural organic reduction, which is also known as human composting or terramation, right? Not cremation, but terra from land. Natural organic reduction is simply a process that hastens, speeds up the decomposition of human remains. It takes about 30 days, 4 to 8 weeks is the general range. The picture you see on the right side of your screen is a climate controlled pod in which natural organic matter, other compost, is laid out before the body is then laid out on top of that matter. This climate controlled pod is one in a whole wall full of them. If you could imagine a wall of cubbies at a company called Recompose out in Seattle. And they were the pioneers of offering this to the public. Natural organic reduction is available now is legal, I should say, in 14 states. But there's often a lag between when it is legalized and when it becomes available. For example, it was legalized more than a year ago in New York State, but the industry has been slow to catch on. Demand hasn't yet picked up for it here in New York. In terms of Jewish law, the letter of the law doesn't make it clear whether this is permitted or not permitted, but we can understand the spirit of the law. And we did a program with Rabbi Jeremy Kalmanovsky from the conservative movement, who wrote a legal paper on this issue. And we have the recording available on our website. He wrote about new alternatives to traditional burial and detailed natural organic reduction. And his conclusion is that if a family is to choose natural organic reduction, what we do with the remains is actually the more important piece, meaning after the body is returned to dirt, to dust, we can't use those remains for any human benefit. If you have a composting pile and you put your banana scraps and your eggshells there, and you use that then to fertilize the food that you're going to eat, that's deriving a benefit from the compost. We can't use human remains to fertilize plants that we intend to eat. So his recommendation is that we still treat the organically reduced matter, the human remains, with the same reverence as we would had we buried them at the time of death when the body was whole. That we still consider ways to bury the remains, elevating it to a sacred act as if it were a traditional Jewish burial. So it's a little background about natural organic reduction. And we've had a lot of questions about green burial. So here's the source from Torah, from Genesis: from dust we come, and to dust you shall return. And so green burials, if you look it up on Rabbi Google, you'll see these answers: that it's an eco-friendly option, it returns the body to the earth naturally, it uses biodegradable materials and avoids toxic chemicals. How do we do that? By prohibiting embalming, by refraining from using metal in the construction of the caskets that are used, and by avoiding concrete vaults. You may live in a place, because of the instability of the ground, it is required to use a concrete vault in a burial in ground. Green burials avoid the use of concrete vaults where possible. They use shrouds and eco-friendly containers, sometimes a wicker basket or a plain pine box, which is Jewish tradition. And it allows for a natural decomposition that takes a lot longer than the natural organic reduction, but eventually the body returns to the earth. So I'll let you in on a well-known secret: traditional Jewish burial, following all of the Jewish laws of traditional Jewish burial, is a green burial. It is the greenest option you can have out there. You can find more information about this on websites like the Green Burial Council, which is a national organization that sets standards for green burial. And more Jewish cemeteries are becoming certified by the Green Burial Council these days, just to validate that the practices they're already using fall in line with the green burial practices. One more piece of information that's not commonly known, when you buy the plain pine box from the funeral home, the most traditional options will have holes cut in the bottom of the casket so that once it's placed in the ground, the body has contact with the dirt to allow the decomposition to start, and to eliminate separation between the body and the earth. So that's a little background about green burial. My recommendation, if you have more questions about this, is to research your options locally where you live, and you can reach out to us if you need some help finding where to reach out locally. You can always reach us at hello@showmarecollective.org. So now we're going to talk about medical aid in dying. I am going to start with the definition and who is eligible and what the process is. Okay, so first of all, medical aid in dying is a legal, voluntary practice allowing someone who is mentally competent and terminally ill, meaning that they have been given a prognosis of 6 months or less to live, that they have permission to request a prescription for medication to end their lives. So if you live in a state where it's now legal, this is what we're talking about. It is now legal, if you have a terminal diagnosis, to request a prescription for medication to end your life. Eligibility in the states where it has become legal, and I'm again talking about the United States now. Canada is similar, a little different. Eligibility: patients must be 18 years old, diagnosed with a terminal illness, mentally competent, and able to self-administer the medication. This is important. Medical aid in dying in the states where it's legal in the United States needs to be self-administered. You need to be able to drink the lethal cocktail. In Canada, you have the option of self-administration, but the majority are done by a physician who administers a lethal injection. It is physician administered, or you have the option of that in Canada. In the United States, it's only available as a self-administered oral medication. Process and safeguards in terms of the legalities: it requires multiple requests, oral and written, confirmation by two physicians who both certify that your prognosis is 6 months or less, and a mandatory waiting period. That waiting period is different depending on which state you live in, and it is voluntary. The patient must ingest the medication themselves. No one is legally permitted to administer the medication. That is the basics of what it looks like legally in the states where it's legal. It's legal in 13 United States and the District of Columbia. So that's the background. Let's look now at the tension between personal liberty and community responsibility. See a picture of the Declaration of Independence on the screen. As Americans, we have big ideas about personal autonomy and freedom. I said earlier, my body, my choice, right? It is my choice what I do with my body. And yet, if I live in a state where medical aid in dying is not legal, then I don't have a choice necessarily, you might say. See here the excerpt from the Declaration of Independence, which bases its acknowledgement of freedom on the biblical idea, right, from Torah, from the Hebrew Bible, that we are all created in the image of God. We hold these truths to be self-evident, that all men, humans, are created equal, that they are endowed by their Creator with a certain unalienable rights, that among these rights are life, liberty, and the pursuit of happiness. So we have the right to life, however you understand that, in the Declaration of Independence, right? These are American freedoms. I'm going to share a few ideas next from Jewish wisdom to hold in tension this idea of freedom from the American context and the idea of communal responsibility, the idea of personal autonomy as it comes up against making sure we're taking care of the most vulnerable in our community, for whom accessing appropriate health care can be a challenge with our broken healthcare system. So, three bits from Jewish wisdom that I want to share. The first is a quote from the book of Leviticus. Do not place a stumbling block before the blind. Now, this idea is often used in the arguments for disability justice that we shouldn't put anything in the way of someone that would cause them not to be able to continue on their path. What do you understand this to mean? And I want to remind us that this text is used to remind us of our responsibility to avoid creating barriers to access for the disabled. In this case, we might think about it as barriers to accessing appropriate health care. Think about all the barriers that exist in our healthcare system to be able to get what it is we need at the time we need it, right? I need a pre-authorization from my insurance company. I need to have insurance. I need to have the finances to be able to afford insurance. If I don't have the finances, I need to apply for government benefits to be able to access healthcare in this country. Think about all the barriers that already exist in trying to access healthcare, basic healthcare. And here we have the biblical commandment to avoid putting barriers in front of someone to prevent them from being able to access what they need. So my question really is, how might we make sure that everyone, regardless of ability, can access the healthcare they need to support their ability to live, regardless of things like cost or disability, right? Everyone in this country, in an ideal world, and unfortunately we're not living in an ideal world, should have access to the healthcare they need. This is a Jewish idea that goes toward the conversation about medical aid in dying and how do we make sense of it, right? You have people who might be inclined to choose it because they don't have access to the healthcare that they need to keep them comfortable and to keep them alive. So this is the first of three Jewish sources that I wanted to share on it. The second is the responsibility to help others, especially those in need. Not just to avoid putting up barriers to prevent people from getting what they need, but to take action, right? To use a more active stance, to not stand idly by when someone is in need, literally when they're bleeding, right? Someone falls down in the street, you notice they have bumped their head and it's bleeding. You have an obligation, Jewishly, according to Torah law, not just to stand there and do nothing, but to do something. It's your responsibility when you see another human being bleeding, or insert your own understanding of what bleeding might mean, right? To do something for them. So this could be understood as a responsibility to do anything and everything possible if someone is suffering, to alleviate their suffering, to help them. The third source in this series that I wanted to share, again, is about protecting the vulnerable. It comes from the book of Psalms and is one of many reminders in Jewish wisdom of our responsibility to protect the vulnerable. Often categorized, the vulnerable in tradition is often categorized as the widow, the orphan, and the poor, a category understood to mean that people who in traditional ancient terms didn't have someone to take care of them, right? A widow would be someone who didn't have a spouse to provide for them, for example. And so here we see in the book of Psalms, judge the lowly and the orphan, give justice to the dependent and the poor. What does it mean to act with justice, righteously, with people who are dependent and or are poor? Rescue the lowly and the defenseless. We have an obligation to help them, save them from the hands of the evil ones. I can only imagine that if it was just a few of us sitting around a table talking, some of you might say, well, the healthcare corporations are the evil ones. And how are we going to save the poor and the defenseless from the decisions about pre-authorization for the care, right? And these are the kinds of systems that are barriers to being able to save the defenseless and the poor. So three sources, three ideas. And I asked the question, how might we understand these ideas, ancient Jewish wisdom, in light of the increasing availability of medical aid in dying? How can we protect the most vulnerable from being exploited? How do we remove barriers to accessing appropriate care. I'm going to offer one more piece on this in this portion of our program. It's called the slippery slope argument. And after I do that, before I then go into Jewish law opinions from the various denominations of contemporary Judaism, I'm going to pause for questions and discussion. So, furthering this just a little bit more, we have what's known as the slippery slope argument, right? For those of us who have been in conversation, these topics come up time and time again. But what about? But what about? Now, we said earlier in the legal definition where medical aid in dying has been approved state by state, there are safeguards that are in place. And so the question exists, well, what happens as time goes on and maybe the safeguards that are in place today evaporate? Laws change. Who's in power deciding changes, right? In New York, for example, Governor Hochul required specific limits to the law before agreeing to sign it in this state. Well, she's not going to be the governor forever. What if there is a different person in charge and there is a lobby to change some of those safeguards? What happens in the case of a mental health argument? And I'm going to detail that using a case in Canada in just a minute, or in cases of dementia. In the United States, if you have a dementia diagnosis, you cannot access medical aid in dying based solely on the dementia diagnosis. Why? Because you need to be able to make the request and take the medication at the time that you have been certified to have 6 months or less to live. So usually when the early dementia diagnosis is given, you may not also yet be certified as having 6 months or less. This is why we see cases like the story of Ruth Messenger and her husband Andrew going to Dignitas in Switzerland, where it was a possibility to access medical aid in dying, or the equivalent of it in Switzerland, with a dementia diagnosis. In the United States, it is not possible at present to access it with a dementia diagnosis. And then the question about disability rights. What about the disabled who don't have access to appropriate health care? Should they or shouldn't they be able to use medical aid in dying? How might the disability rights community feel about the idea that they're somehow less than and could be put in a vulnerable position where medical aid in dying is chosen for them, right? This is where, the idea that it has to be self-administered. Well, what if you don't have the ability to take in something by mouth? You ingest only through a feeding tube, or you don't have use of your hands and can't, hold the cup with the lethal liquid to your own lips. Someone else has to hold the cup for you with a straw. Well, legally, that's not permitted. So these are some of the slippery slope arguments. There's one story in particular that was in the news recently. This was just at the end of December 2025. And for those of you who haven't seen it, it's an article that talks about what's going on in Canada with questions about whether patients with a mental illness diagnosis should be allowed to access medical aid in dying. Now, again, in Canada, the laws are a little bit different. You can self-administer, but it can be administered by a physician. And the safeguards that are in place in each of the states where it's become legal here in the United States are a little bit different in Canada. It is more readily accessible in Canada. Right. So here is one example of the mental health slippery slope argument. Should someone who is declared competent, able to make her own decisions for her own body, be able to choose to end her own life as a result of the suffering that she experiences because of her mental health diagnosis? And the other one that I want to point out is an organization called Not Dead Yet. And this is a grassroots disability rights organization that opposes the legalization of medical aid in dying, of assisted suicide. As they say, I'm using their language, you see it up on the screen, deadly forms of discrimination, right? What would happen if other people got to make a decision for someone who is disabled about when they should die as a result of them not being able to communicate or take control over their own decision making. So, this is another slippery slope argument when it comes to, well, if it's legal, what are the dangers of legalizing it in more states? This also brings up concerns about coercion, that disadvantaged people could be coerced into making a decision as a result of their disadvantages or as a result of the difficulties in accessing appropriate care. Now, I've given you a lot of information, so I'm going to pause that. Samantha, any questions come up?
Yeah, I'm wondering, David Balto's question.
Mm-hmm.
I'm a chaplain with an elderly patient who seems to be choosing MAID. She seems a little uncertain, but affirms she wants to do it. Her children are outside the room and are talking about that if they don't use MAID, the medical expenses will take up all of her remaining I assume assets.
Assets. Yeah.
What should I do?
Yeah. Well, you're a chaplain working in a healthcare context. I imagine you have access to supervision. First and foremost, if you're a professional, you should be discussing this with your supervision. And if you work in a healthcare system, you should know what is and is not possible in your healthcare system. Just because it's legal in the place that you live, whether it's Washington, D.C. or New Jersey or California, doesn't necessarily mean that the healthcare system in which you are working or your loved one is a patient is yet providing that service. They may need to access it outside of the healthcare system in which you are working or being served. So, first of all, knowing what's possible so that you can help the family to understand what the process is should the patient be definitive in her decision, I think is important. And then helping the patient clarify what are her concerns, right? If she's feeling a little bit uncertain, what does that mean? What is she uncertain about? Does she want to live longer? What would it take for her to have the quality of life that she wants? Is she experiencing suffering that could be addressed with palliative care, for example? Is she having pain that's unaddressed? That could be addressed potentially. And then having a conversation with the children and then eventually with the family about their concern about medical expenses using up the remainder of her assets. This is a family decision to make about how we're going to spend our money. And the patient, if she has the ability to make these decisions, is the one to make the decisions before her children would inherit her money if any of it is left. This is a tricky topic. I appreciate your example, David, of some of the nuance here, right? That money comes in too often in families trying to figure out whether we should allow mom to do this, right? They may have some moral objections, but the objection is being stated as a financial issue. So, how do we understand it if money wasn't an issue? Is mom suffering intractable such that she no longer wants to be alive in the condition that she is now? I see there's also a question about how the unhoused can access medical aid in dying, people who don't receive regular health care. This is another barrier. This is why in the United States, where medical aid in dying has been legalized, it is really only available to people of privilege, and you can define privilege however you want. In this case, people who have access to health care, people who have access to the money to be able to buy the medication, and then people who have the ability physically to be able to ingest the medication. And state by state, we're seeing this. Of the people who have requested medical aid in dying, only a small number have actually gone through with it. Having it available is something that the proponents say it should be available, even if I don't want to use it, right? So there's that argument or that question too. So, Allison, I don't have an easy answer. I don't think there is an easy answer of how to provide it for the unhoused. I wonder if in Canada, that has come up because people in Canada have access to healthcare differently than they do in the United States. But again, in the United States, where it is legal, it's really only accessible by people who have privilege, the privilege of being housed, of having healthcare providers who will write the prescription, of paying for the prescription, and of ingesting it. All right, I am going now to share some bits of the opinions of each of the major American Jewish denominations on the topic. We'll start with an overview of Jewish law as interpreted by an Orthodox rabbi. This is Rabbi Jason Weiner. He is a chaplain at Cedar Sinai in Los Angeles. He has written books um, for questions about medical decision making, ethics, for patients who are concerned with following Jewish law, traditional interpretations of Jewish law when it comes to healthcare decisions. He's an important teacher on these topics. We've done some programs with him, and I recommend you Google him. He has a website. Invite him to your community if that would be of help to you. This excerpt comes from an essay in My Jewish Learning that asks the question, does Judaism believe in the right to die? And so Rabbi Weiner's response, Judaism teaches that we don't own our bodies. Okay, traditional Jewish idea here, our bodies belong to God, and we do not have the right to destroy them. Furthermore, our lives are not simply needed for utilitarian purposes. Each person is sacred, having been created in the image of God, and there is thus a value to life regardless of one's relative quality or usefulness. The Mishnah, oral law, the rabbis discussing how we should live after this, in the centuries after the destruction of the temple, in the fourth chapter of the Sanhedrin, explains it was for this reason that Adam, the first human created, was created as one person, to teach us that anyone who destroys a life is considered by scripture, by Torah, to have destroyed an entire world, and anyone who saves a life is as if he saved an entire world. Okay, so two ideas really to lift up here. The idea, the traditional understanding, is that our bodies as humans belong to God, and therefore we don't have a right as humans to decide everything because our bodies belong to God. So when my body returns to the earth is in God's hands, traditional understanding. And the second idea is that saving a life is as if we're saving an entire world. Okay, so these are two ideas from a traditional understanding that you might understand to be against medical aid in dying. This is the conservative movement, most recent writing on the topic. This is a paper that was written for conservative rabbis. It is, 40 something pages. It's available on their website, so we're sharing it with you because Jewish wisdom should be accessible. And I'm summarizing it here. This is an update to earlier writings by Rabbi Elliot Dorff, writing for the Committee on Jewish Law and Standards, which is the conservative movement's legal deciding body. And he updated his opinion in 2020 after medical aid in dying became legal in the state where he lives, in California. And we see it becoming legal in other states with very large Jewish populations, where we, Jewish communities, are simply unprepared for the questions that are coming up. And so he says this responsum, this answer to the question in terms of Jewish law, allows patients to request drugs to bring about their death when they suffer from uncontrollable pain and can administer the drugs themselves. His permission, this responsum, his writing, allows patients to request the drugs when they suffer from uncontrollable pain, and they can administer the drugs themselves. It also permits physicians to provide the drugs needed for this purpose. You may ask the question, should a doctor who is Jewish be allowed to do this? So this interpretation is allowing that to happen. It does not authorize physicians to administer the drugs themselves. Okay, conservative interpretation of Jewish law is that it cannot be physician administered. Again, he's writing in the context of how it has become legalized here in the United States. Nevertheless, after the fact, if the physicians have done so, like in Canada, rabbis and others should stand aside without judgment, right? We're not going to excommunicate the doctors who have administered it in Canada. Rabbis and others should provide support and comfort for patients and their families facing this condition, no matter how the patient dies. A Jew should still have access to a Jewish funeral and a Jewish burial, no matter how they die. If they die by medical aid in dying, they shouldn't be prevented from having access to traditional Jewish funeral rites. Okay, so this is a permissive stance on medical aid in dying from a rabbi in the conservative movement in the United States with some safeguards. And again, we saw earlier from the way things have become legalized in the United States, you put safeguards into place, but you can ask the slippery slope argument, right? Later rabbis might reinterpret this with a different angle, and maybe some of those safeguards would evaporate. And lastly, for now, this is from the Reform movement, and this opinion was published in response to the increasing use of medical aid in dying in Canada. We agree in principle that in an era in which medical technology can prolong life to the point that a person's existence becomes torture to them, Refuat Haguf is no longer possible. Refuat Haguf is the healing of the body. Refuah, healing. Rofeh, doctor. Guf is body, right? When the healing of the body is no longer possible, we can at least support the choices of those individuals for whom death is Refuat Hanefesh. We can support the choices of individuals for whom death is a healing of the soul. We're not convinced that in practice any jurisdiction currently meets these conditions, but we set them forth nonetheless, right? The slippery slope arguments exist. The safeguards aren't perfect, but we set these ideas out nonetheless. A Jew suffering from a terminal illness whose death is not imminent may, where it is legal, avail themselves of physician-assisted dying under the following circumstances. The patient has full and unlimited access to all effective medical care necessary, enabling them to live a meaningful life so far as they are able, right? There isn't any barrier to being able to access medical care to keep me alive with a meaningful life. However, I understand that. The patient and their legal heirs have made formal attestation that financial considerations have played no role in this decision. This goes back to Chaplain David Balto's question earlier, right? The kids are outside mom's hospital room saying we're worried that if she chooses to stay alive, we're going to exhaust her assets taking care of her. The reform movement will only permit medical aid in dying if the family affirms that financial considerations are not playing a role in the decision to access medical aid in dying. And lastly, the patient has undergone careful screening by a trained committee of professionals to ensure that the motivation is not untreated depression. Right? This is a safeguard put in place by the reform movement to address the questions about a mental health and mental illness diagnosis. And here we have an answer from this movement saying that it shouldn't be used in the case of untreated depression. Okay, so this is just an excerpt. You can read more from the responsa. I am going to pause again and see if there are questions before I get to now what.
There are some questions around the idea of total pain, including psychic
Yes,
as well as physical pain. And
yes.
then a question around Rabbi Dorff, how he supports his response according to Jewish law.
Yeah. So you'll have to read the fullness of his response to see lots of citations to support his conclusion. I just gave you a summary here. But his idea is based on suffering, if I can summarize it even further. That if someone's suffering cannot be palliated, palliative care can no longer address their suffering, then we can entertain the question of Jewishly about whether medical aid in dying is appropriate. So that's a little bit about Rabbi Dorff's take on it. And uncontrollable pain, right? I'm going to get in a minute to this. Now what? What do we do about this? First and foremost, palliative care is designed to address the suffering physically and otherwise that happens when someone has a life-limiting illness, when someone has a life-limiting diagnosis. How can we make sure that people have access to palliative care, to appropriate pain management, if it can address their pain such that they may no longer want to die, they are willing to live with the quality of life even diminished that they have if the pain is addressed appropriately. Really tough arguments here. Excellent questions. All right, so now here's my question. Like, what do we do about all of this? You have the Orthodox who say, no, my body belongs to God. Elliot Dorff, conservative, says, well, if the suffering can't be controlled in only the certain cases, maybe. And the Reform movement, my teacher, Rabbi Richard Address, um, says the Reform movement's opinion is really no, but yes. So like we're not in favor of it, but because it's legal, if you're going to do it, here are some safeguards, right? So we have those summaries. Now, what do we do about it? First and foremost, palliative care should be used to address the suffering. And I recognize in the broken healthcare system in this country, it is very hard to access palliative care in some places, and it's hard to access sufficient palliative care in other places. That said, this is something that is designed to address suffering in patients, designed as part of the healthcare system. So, where possible, palliative care should be used to address suffering before we get to the questions of medical aid and dying. The second point I want to lift up is an interpretation that I learned from Rabbi Jason Weiner. Do not resuscitate when you fill out a DNR in the hospital, right? You wind up in the hospital and you're in declining health, and they ask you, if your heart stops, if you die, do you want us to attempt to resuscitate you? And you sign the form, yes or no. You inform your healthcare proxy before you wind up in the hospital. If this happens, I do or I don't want to be resuscitated. The do not resuscitate could be understood with different letters as AND, allow natural death, meaning if my heart stops, instead of attempting resuscitation, which in a frail body will likely break the bones in order to reach the heart, to attempt with chest compressions the possibility of starting the heart again. Instead of attempting resuscitation, I want to allow natural death to happen. I want to allow the course of my disease to end my life, whether it be old age or cancer or whatever the cause of death will be. Right. So allowing natural death is another way to understand do not resuscitate, not don't take action, but rather allow natural death to happen. If my body belongs to God and my heart stops, so be it. Allow natural death to happen. Okay, so those are two ideas, palliative care and allowing natural death, to try to help you answer these questions of now what? And I can't elevate this enough. The importance of talking about your end of life wishes early and often. Let our conversation today motivate you to have a conversation with the people in your life who need to know what your wishes are. Make sure you have a healthcare proxy. I'm going to put in a plug for our What Matters program, in which we help you to figure out how to choose a healthcare proxy, who's going to make decisions in the event I can't make decisions for myself, and how to prioritize what your wishes are for end of life care. So these are some ways that you can begin to make sense of it. And I want to share one more bit of Jewish wisdom before we'll take questions for the last 10 minutes. This is a story that comes from the Talmud. And again, Talmud, Mishnah, oral law, the rabbis discussing in the first centuries after the destruction of the temple, right? When the temple was standing in Jerusalem, we worshiped God by bringing sacrifices to the temple. Once the temple was destroyed, the rabbis were trying to figure out how are we going to live our lives now, always with the hope they had that, and this is contained in our liturgy, the temple would be rebuilt. But with the acknowledgement that as time went on and it wasn't being rebuilt, we needed to figure out a different way to live. Because the way that we had lived our lives was no longer possible. And so this is a discussion that we see in the Talmud of figuring out how are we going to live our lives. On the day that Rabbi Yehuda Hanasi, a very important figure, died, the sages, the rabbis, decreed a fast. It was a fast day. We have to concentrate. Right before he died, they were fasting so that they could pray that he wouldn't die. And they said, anyone who says that he has died will be stabbed with a sword, right? We're praying to keep him alive. Don't even say the words that he has died. And his maidservant, Rabbi Yehuda Hanasi's aide, in essence, if we can understand it in contemporary terms, saw him suffering, and she went up to the roof of the house, and she said, she's praying. The upper realms, the heavens, are requesting the presence of Rabbi Yehuda Hanasi, right? The heavens say, we're ready for you. And the lower realms, we humans here on earth, are requesting the presence of Rabbi Yehuda Hanasi. His students were praying for him to remain alive among them. May it be the will of God, this is the aid praying, that the lower worlds should impose their will upon the upper worlds, right? May it be God's will that the lower worlds, humans, win out, that he should stay alive. However, when she saw how many times he would go to the bathroom. He was suffering from gastrointestinal distress nearing the end of his life. And at that time of his life, in contemporary times when he was alive, men wore their tefillin all day when they were engaging in study. And so she saw that he had to take off his tefillin every time he went to the bathroom and then put them back on. And if you know someone who's suffering from a stomach illness, he's running back and forth to the bathroom, and how he was suffering as a result, right? It's take it on, put it off, all these things. She changed her prayer. She said, may it be the will of God that the upper worlds, the heavens, should impose their will upon humans. And the rabbis, meanwhile, wouldn't be silent. They continued, his students, to pray, begging for mercy so that he wouldn't die. And she's up on the roof. She took a jug and she threw it to the ground. Due to the sudden noise, the sages were momentarily silent. They were stunned, right? If something falls outside, your house, and you're standing there and you hear it, you stop and you look. And they refrained from praying for him to be alive in that moment. And in that one moment that their prayers stopped, he died. His soul flew to the heavens. Right? So here we have a story recognizing intractable suffering, the desire to keep someone alive as long as possible. Our bodies belong to God, and the recognition that the suffering might be more than the body could take. And if we stop praying for him to stay alive, then he could return to God if our bodies come from God. So I just wanted to end my teaching with this Jewish story to help illustrate the tensions and the challenges here. And now let's turn to you and the remaining questions. Right, this is why hospice teams include nursing, psychosocial, and spiritual care. If you're not familiar with the hospice benefit, hospice care is provided by a team. You get a doctor, a nurse, a social worker, and a spiritual care provider, who are all required to check in with a patient at certain differing intervals. But a chaplain is part of the Medicare and Medicaid hospice benefit in this country. Do the Reconstructionists have an opinion? Excellent question. And you can look for the answer on Reconstructing Judaism's website. I know individual Reconstructionist rabbis have voiced opinions on the matter, but their availability of their opinions is different than the way the responsa is published by the conservative and reform movements.
There's a question from Sherry about, what do the commentaries say about the maid? Did she indirectly cause his death?
One might imagine that some people would say that she did cause his death, but rather, I think the story is saying that when we stop praying for someone to be alive, meaning we stop praying for someone to continue suffering, intractable suffering, there was no palliative care available to him, that it's okay for him to die and to return to God. And in fact, the Orthodox rabbis who have taught for us, including Rabbi Shlomo Brody when he did a program, remind us that it's okay to pray for someone to die, right? If their suffering is so great and you want to pray that they return to God, if you believe your body belongs to God, that is permissible in traditional interpretations. Right? So the cessation of praying for him to stay alive wasn't praying for him to die, but maybe it was. Maybe it was his aide praying for him to die through her actions. And therefore, we see this outsider's voice coming in to create the change that is needed. Right? We understand our bodies belong to God. We want to keep our rabbi alive as long as possible. And the outsider voice, the female voice, the lower status person comes in and helps us to gain a little perspective on this situation, that if our rabbi is suffering, uncontrollable suffering should not be how he continues to live. Does the body return to God or the soul? All right. So, in very simple terms, the body returns to the earth, right? From dust to dust. We saw that quote earlier from the book of Genesis, and the soul returns to God. Friends, it has been an honor to be engaged in this topic with you over the last 3 months. These are not easy times that we are living in, no matter what you're talking about, whether it's politics, life, war and peace, poverty and affluence, medical aid in dying, broken healthcare systems. There are challenges everywhere we turn. And what I hope is coming through in our conversations together is that by sitting together and studying Jewish wisdom, we can benefit from the conversations that have been had by generations before us to understand that it isn't an easy question and it isn't an easy answer, but by having the conversation, we are better off. If we can be helpful to you in finding resources in your own community, reach out to us, hello@shomercollective.org. I want to encourage you to take a deep breath because when we talk about death, we're talking about life. When we're willing to do the hard work of confronting our mortality, we can live more deeply into who we are. If you have benefited from our work, help support the work going forward. We're a little startup nonprofit, a tiny team, and thanks to generous donors, we're able to be here doing this work. Help us out by giving a donation. And again, if we can be of help to you, hello@shomercollective.org. Thank you for being with us.